So my name is Peter Chin Hong. I'm a professor of medicine and an infectious disease specialist at UCSF.
How would you describe what it is that you do?
So I study infectious diseases, which are little microbes, bacteria, viruses, fungi, amoebas that can cause people to get really, really sick. And this includes, of course, for the last 2 years, SARS-CoV-2, which is a virus that causes COVID-19.
What inspired you to become a scientist and doctor?
Yeah, so I'm from the Caribbean, from an island called Trinidad. It's part of a country, Trinidad and Tobago, two islands, one country. It's the most southern island in the Caribbean chain, right next to Venezuela. And growing up in a rural area and running around barefoot, I always worried about getting infectious diseases, even at the age of 6. I remember reading about hookworm, which is a parasite and can cause people to get really sick after it burrows into your bare feet. And during high school there, I had a friend whose dad got HIV disease and AIDS and ultimately died. So it is really I think the big motivation factor for me to not only study medicine, but to study infectious diseases. So I came to the United States for college and then stayed here for medical school and the rest of training as a doctor, which is called residency. And then I specialized in infectious diseases.
What excites you or makes you feel optimistic within your field?
I think one of the amazing things about the pandemic, of course, there are a lot of dark moments as well, but the amazing aspects were really driven by science and scientific discovery. Who would have ever thought that we could develop a vaccine that quickly? We've never done that fast in the history of science or medicine or infectious diseases. And not only that, we were able to tailor make the vaccine and potentially modify it as we get new versions or variants of COVID-19. I think, when you think about science and medicine, science in the community, there are so many different facets. And when you're broadly trained, you can enter doors that were previously closed or you didn't even know were there until you face something as terrible and as life-altering as the COVID-19 pandemic.
Any advice for aspiring scientists and medical professionals?
So the first thing is find somebody who's a trusted advisor, find somebody who can take care of you, mentor you along the way. There are many programs like the one that you're going to that tries to excite you, but in that process, you'll meet people along the way who will care very deeply about you. I was lucky that I had people along the way, and if I didn't have them, I probably would be doing something completely different because these people can give you advice, they can write you letters, they can track you along the way and give you comfort, they can give you knowledge about different careers. The second aspect is to keep your eyes open. I think I was always going around the world and navigating the world with eyes wide open because I was very curious. And what that did was really let me see aspects or things that were new to me, and I didn't even know those opportunities existed.
What do you think is important about science festivals like the Bay Area Science Festival?
Science festivals are so crucial to the community because they're not only just exciting because you're seeing something new, they set off sparks in your mind, they give you access or insight into future versions of yourself that you didn't even think existed. They help you meet people who can probably be your confidants and mentors in your journey as you get older. And most of all, they provide you with inspiration because you are going to be the next generation who will take care of me, who will take care of my family, who will take care of my loved ones. And we're counting on you. And this is the place that will inspire you for that future.